Okay, y'all. Hey, y'all. Hey. So, as y'all know, we still are talking about these ailments, how you may have an ailment that's going on, how internally you may have some issues going on, and it may be exacerbating that issue. And today we're going to talk about your neck. You know, the neck is the connector of so many things. And you know, when your neck is bothering you, you got a lot going on. Make sure you get your neck disorders together. If you've been seeing a doctor for, you've been seeing a chiropractor for, you've been seeing all of the things, you might got some internal things that are going on in your heart and your mind and your body that is making these things a little bit worse or exacerbated. So, are you somebody who has relationship issues and you carrying all of that in your neck? Are you somebody who has the inability to communicate what you're really feeling? Are you a poor communicator? Are you somebody who feels stuck? Are you an inflexible person? Baby, don't be like that. Are you somebody who feels like you're not uh, presented very well to others, or you have a poor ability to present yourself? You know, you can't effectively communicate who you are. Are you somebody who feels like you're being strangled, literally? Are you somebody who gets choked up on your words? Are you somebody who feels like you sweep issues, you know, down there and you hold on to them and you can't get them up and get them out? Are you somebody who has a lot of unresolved issues with your love of your life, your parents, your children, and you just hold on to it? Are you somebody who has very poor awareness? Are you somebody who's an overthinker? If these are you, you know, it's some things that you could do on your own. There's some things that some tools that you could use that we're gonna talk about. These are holistic tools. We're gonna talk about some herbs, but we also gonna talk about if it's too much for you, what you need to do. So let me get my disclaimer. Hey, I'm Taushie. Tell me happy Nurses Week, because I am a registered nurse. However, that's not what we're here for. If you are under the services of any health care provider, any of them, anybody that takes care of you, any doctors that you go see that have a diagnosis attached to you, that have medicine attached to you, this is what I need you to do. We're going to talk about some herbs a little bit later. And so if you decide that, oh, I like this herb, I like what it might do for me, I've never tried it, I want to add it to my regimen, but I'm currently taking medications, I need you to stop before you go out and you buy it. I need you to go talk to the pharmacist. I want you to talk to a pharmacist. I want you to say, hey, I like this. What's in it? Can I take it? Is it contraindicated with any of my medicines? Do I need to go back to my doctor and see if he, she, or they can make some, switch ups on my medicine? If you need to do that, do that. Please, please, please don't just add a herb because you heard somebody mention it, or you looked it up on the internet and you said, I just want to add it because it looks like it'll be beneficial to me. Remember, majority of our medications that we take nowadays, they derive from a herb. So you want to make sure one is not canceling out something or you're not getting too much of something. Then go talk to your doctors, all your doctors, any doctor that prescribes a med for you. You want to let them know you're taking an herb. You want to be able to put that on your med list because we have to know. Sometimes an emergency could happen and we don't know what's going on because this is going on because you got something that's contraindicated with something else. So do those things. But some of the other things that we're talking about, this is holistic kind of care. If you're looking for a holistic practitioner, you need to research in your city or your or if they have it available within your insurance coverage. You need to talk to that person. You need to see if they take your insurance. If they don't take your insurance, remember that those visits could be a out-of-pocket expense to you. Then we're going to talk about your feelings, your emotions, and all of those things. If some of the stuff that we're talking about is a little bit too heavy, you don't think you can move that energy around, or you don't think you got the tools, you need to talk to a psychiatrist, a licensed social worker, or a psychologist. So, psychiatry is your medicine talk people. There are those people that may say, hey, these issues are a little bit deeper. I might need to give you a little bit more medication for it because you got a balance that needs to be balanced out. You got an imbalance that needs to be balanced out. Then you could say, okay, I don't think I need that, but I do need somebody that can give me some more tools. So those will be either your licensed social worker or your licensed psychologist. So those are your talk people. Those are the people you're going to set up appointments with. You're going to have your little conversations with. You're going to see if they can help you work through some of these feelings that you may be feeling that I talked about. Because sometimes it's hard for you to get past them, because internally there are some things that are going on. You're still holding them on in your heart. You're still holding them on in your mind, and you can't push past them. And now they're exacerbating. And since we're talking about the neck, but any body part. So all of that is my disclaimer. So let's talk about some things that you probably could do on your own. I want you to stop for a moment. You have neck issues. You done went to the chiropractor. You done been to the doctor. This neck is still bothering you. It's stiff. It's whatever. It's whatever you have going on with your neck, and you've seen somebody clinically for it, and you just can't get past it. These are some things that possibly you could do. Stop thinking about those things that you cannot control. Stop. Try your best. Learn how to stop it. Start to journal. Journal out those emotions. Journal out those feelings that you got feeling that's so tight in your neck, that got your neck clenching, that got you holding your neck really, really stiff. You're waking up with a stiff neck. If you've done some of the things that you could do, also, if you got a stiff neck, you got a bad neck, it might be your pillows. So get you some different pillows as well. But if you just don't know what's going on, you're holding on, you got pain, you don't know where the pain is coming from, you did this, you're massaging, you're doing all of the things, you got to start working through it. You got to start working out those things. Are you somebody who's holding on to a relationship that you need to let go? Are you somebody who is feeling like, I can't communicate what's going on? Start talking. And sometimes talking might be talking to yourself, talking to the camera, just talking to get it out so that you can learn how to communicate. Get you some books on communication if it's ineffective for you, if you can't seem to figure out what you're doing to make conversations go left, or you feel like I don't have what it takes in order for me to get whatever I need to get out. If you are a person that is poor on commitment, start taking baby steps to start to do those committing things. Don't overdo it. Small little things. I said I was going to do this. Knock it out. That means you did it. Start to learn how to deep breathe. Part of your deep breathing is you got to learn how to relax your shoulders. You got to learn how to relax your mind. You got to learn how to relax your face. All of this is connected. So when you breathe in, you want to make sure your shoulders stay low. You don't tense them up. You want to make sure that they're low, and you want to breathe out. See how my shoulders drop? You want to drop those shoulders. You want to practice that, because it's going to help to get some relief and get some of that tension that you may have in your neck out of your neck. It's going to teach you how to do those things. Massage, left, right turning, get your neck massager, but you got to learn how to release that tension that you're holding in your neck. I talked about journaling, I talked about massage. You might need to get some heat. You might need to put some oils on there. We'll talk about a few in a little bit. You want to ask your body to remove whatever those feelings that you are holding on to. This should be a daily affirmation for you. Remove don't serve me. Remove my inability to properly communicate. Remove my inability of feeling stuck. Ask your body for that. Ask your body for that along with breathing. Journal out those emotions that you're feeling. Learn how to, when you feeling that tightness, you feeling like, oh, I'm getting tight in my jaws and my neck and my shoulders. That's when you start your breathing. Look at what is triggering you to get those feelings. And when they are triggering you, if it's a person, get rid of it. If it's a place, get away from it. If it's a thing, don't use it anymore. So remember those things and try to get them out. Ask your body for 100% healing of whatever is going on, whether it's a feeling, whether it's pain, whether it's whatever is going on. Ask your body to deliver that to you. So now to my favorite part. Y'all know my favorite part is the herbs. We're going to talk about 10 herbs that you can use. There are some more out there, but we only going to do 10. Again, if you're under services of any doctors, let them know you want to start a herb. Do some more research on the herb. Talk to the pharmacists about the herb. Talk to your doctors about the herb. Be very careful. Always start herbs slow and then increase as the need becomes greater. Okay, so let's talk about it. So turmeric, y'all know how I feel about turmeric. Turmeric is the GOAT. What will turmeric do for your neck? It will help to decrease some stiffness you may have in your neck because it has anti-inflammatory properties. anytime you got inflammation, you're going to have pain, swelling, stiffness, all of the things that will be associated with pain. You'll have those things. You want to get any inflammation out of whatever part of your body, including your neck. And that is what turmeric would do. You could cook with turmeric, and you can have it in a tea. You could do some oils with turmeric. You could do a multitude of things. And when I say talk to your pharmacist about things, this is if you're going to ingest anything you're going to put in your mouth, you want to talk to the pharmacist about that, and your doctors as well. Ginger, another one of the goats. This is going to help to decrease any pain, muscular pain that you may be having. Why? Because it has anti-inflammatory properties. You could also cook with this. You can have it in a tea. You can make it in an oil. You can do all of the things with it. Massage your neck with it. Baswale. This is going to be used topically. You do not ingest baswale. So you're going to make this as topical. You're going to rub it on your neck or rub it on those areas that you may be having some tension in. This is going to help to soothe and relax your muscles. Devil's Claw is going to, you can use it in a tea. You can use it as a tincture, which is like putting it under your tongue. It's like an oil. You are going to use this. This all helps with overall skeletal muscular pain. So you can rub it anywhere. But specifically, we're talking about the neck. Then we're going to go to willow's bark. If you have an allergy to aspirin, this is a no-no. So this is, because this is a derivative of aspirin, or this is the byproduct, or however you want to say it. Aspirin comes from here. So you can use this in your tea, and you can use it as a capsule of some sort. And so then you want to be very, very careful, again, if you are already taking aspirin. And if you're taking anything, remember, aspirin thins out the blood. So if you are taking something that will do anything with your blood, remember, that's why you need to talk to the pharmacist. Valerian root. I would tell you to take this in the evening time. This is one of those evening things. You can take this as like a little nightcap in a tea, but you also can take it as a capsule. It is going to help to calm your nervous system or calm your nerves. It's going to help to relax your muscle. It's going to help to decrease any tension that you may be having. Next is chamomile. Y'all know what chamomile is like, one of those, another one that's good at nighttime. Any time of the day, but good at nighttime to help you relax. It's going to decrease any stress. You can take it in a tea, or you can make it as an oil. Rub it on, and all of the good things. Peppermint. Peppermint is another one of the goats. I'll tell you this. I do make tea blends, and you can put peppermint in almost anything because it's going to just add a little bit. But for the neck, you can make it into an oil, use it to rub on your neck. You could drink it in your tea. You could, because what is it going to do? It's going to help to relax your muscle. It's going to, if you're having any spasms, it's going to have a cooling effect. It's going to have a soothing effect and just make you feel good overall. Arnica. This is only used topically. So you're going to make it into a salve or a cream of some sort, rub it on your neck, and it is going to decrease any inflammation that you may be having and take away any soreness that you may be having. Some people might drink arnica in a tea, but I would tell you to take it in a cream. Cayenne. So cayenne is another one. It should be on your, always got in your household at all times. As an oil, I keep it and cycling all the time, and cycle all the time, and it's good. So cayenne has what we call capsaicin. Capsaicin is, I know y'all go out and y'all buy some capsaicin oil. Some capsaicin cream. That's what you rub. You rub it on whatever has an ailment. So you can use this topically. You can use it as a salve. You can use it as a cream. You can cook with cayenne. You can make it into an oil. All of the things. So what capsaicin is going to do is going to increase your blood flow, and it's going to decrease pain. Anytime you increase blood flow, it's going to stop stuff moving around. So I hope that this helps. Having neck problems is probably one of the worst things that you can have going on. So I would implore you that if your neck issues cannot be resolved through, any kind of going to see the chiropractor, go to a stretch lab, go try to do all the things, try to do a little stretching yourself. If it can't be relieved by that, think about some other things that are going on with you. If any of the things that I mentioned are you know what, work on them. I hope that you enjoyed this. I hope that you share this out to someone who's having neck problems. They can't figure it out. They've done all of the things, and now they're trying to figure out, is it something else that's going on in my heart and my body? Is what is causing all of this? Can you share? If you got some questions, add that to me. Don't forget to talk to your doctors. Don't forget to talk to the pharmacists. Don't forget to seek additional help if you need it. And I will see y'all real soon for the next body part. Peace.